Hello. Today I'm going to be presenting on the study titled Public Healthcare Management of Water Pollution with Pharmaceuticals, Environmental Classification and Analysis of Pharmaceutical Residues in Sewage Water. And my name is Hunter Rabinowitz. This research addresses the growing issue of pharmaceutical residues in water and explores how an environmental classification system can help reduce these pollutants. This topic is very important as it directly relates to public health, environmental sustainability, and proactive healthcare management. So, without further ado, let's dive right in. To begin, the thesis statement of this study is that implementing a classification system to evaluate the environmental impact of pharmaceuticals can effectively reduce contamination in water systems. This study is significant for several reasons. First of all, pharmaceutical residues in water are an emerging problem that affects both human health and aquatic ecosystems. For one example, drugs that persist in the environment can harm the aquatic organism and then potentially cycle back into drinking water or what we eat, exposing humans to involuntary medication. Secondly, addressing the issue requires a proactive, structured approach, which this classification system provides. So, this study highlights the importance of balancing pharmaceutical use with environmental protection. The study focuses on a pressing research problem: how to manage pharmaceutical residues in water to protect public health and ecosystems. These residues often pass through sewage treatment plants and end up in surface water, where they pose risk to aquatic life and indirectly humans. The researchers hypothesized that a classification system evaluating the pharmaceutical based on its environmental impacts, such as its biodegradability or its toxicity, would not only raise awareness but better guide prescribing practices to reduce the contamination. Now, moving on to the setting, context, and time frame of this study. The study was conducted in Stockholm County, Sweden, a region known for its proactive environmental policies. And here, the background is the city of Stockholm, and that is its flag, you can see. The researchers implemented the classification system in 2003 and conducted annual evaluations of pharmaceutical residues in wastewater and surface water. And the article was published in 2005. And then, of course, the context of this is that public healthcare efforts to manage pharmaceutical pollution is a pressing concern and very important. Now, moving on to how the data was collected. The researchers used two-pronged approach for data collection. First, they relied on data provided by pharmaceutical manufacturers regarding the biodegradability, bioaccumulation, and ecotoxicity of their products. This information was used to classify pharmaceuticals into categories based on their environmental impact. Second, Secondly, they collected samples from sewage treatment plants and surface water to directly measure the levels of pharmaceutical residues. This combination of theoretical classification and empirical sampling provides a comprehensive understanding of the issue. However, it is worth noting that relying on manufacturing data can introduce biases, as not all companies may report the completely or accurate information about their products as they're trying to kind of look out for themselves. Well, what did the study actually collect? What was collected? Well, the study found detectable levels of certain antibiotics and viral inhibitors in the sewage treatment plant, as well as dangerous drugs. Interestingly enough, surface water samples showed lower levels or even undetectable levels of these pharmaceuticals, suggesting that the treatment plants are somewhat effective at reducing the contamination before it even reaches the natural water sources. However, the persistence of these drugs in sewage water underscores the need for better pharmaceutical design and especially pharmaceutical disposal practices. These findings show a solid foundation for understanding the scope of pharmaceutical pollution and the importance of addressing it. So, what does this data actually mean? Well, the presence of measurable pharmaceutical residue in sewage water really does show the limitations of current wastewater treatment technologies. They really can't get through these heavy drugs or pills or whatever it is. While surface water contamination was less significant, the data still showed the risks posed by persistent drugs. These findings definitely validate the need for ongoing monitoring and improvements in drug design to reduce environmental impact. Also, the study reinforces the importance of collaboration between healthcare providers, pharmaceutical companies, and policymakers, as well as outside third parties, to address this issue effectively. A graph from the study visually demonstrates the concentration levels of key pharmaceutical residues, showing even further evidence of the problem. Now, if we look at some limitations of the study, like any study, there are some limitations. Firstly, it does rely, as I mentioned earlier, heavily on manufacturer provided data, which may not always be accurate or complete. If a company would share information that could shine light negatively on them, they might choose to not do that to protect themselves and protect their wallets. Secondly, the study focuses exclusively on Stockholm County, making it difficult to generalize the findings to regions with different environmental conditions or infrastructures. Another key limitation is the lack of a direct health impact assessment. While the study does discuss the potential risks of pharmaceutical residues ending back up in our waters or our food, we have no idea of its actual measure and their actual effects on human or aquatic health. This gap does highlight the need for further research to actually understand the full scope of the issue. Also, the studies focus on antibiotics and viral inhibitors leave out significant drug classes like hormones and painkillers, which can also lead to water pollution. So, in conclusion, this study demonstrates that an environmental classification system can be a valuable tool for managing pharmaceutical pollution. It raises awareness among healthcare providers and encourages the use of less harmful drugs, ultimately helping to protect public health so that and the aquatic ecosystems as well. So the so what of this study is its proactive approach to grow a growing problem that is on the rise. While the system is not a complete solution, it does represent a critical first step, in my opinion, towards addressing pharmaceutical contamination. As I said, we don't have the full effects on what it might do to ecosystems or humans, but it seems as if it could be dangerous, and it's better to not have to find out than find out and people are hurt. By implementing similar systems globally, we can work towards a more sustainable balance between healthcare and the environment. So the reference that I only have is the actual um, research paper itself, Public Healthcare Management of Water Pollution with Pharmaceuticals. And yeah, thank you so much for watching, and I hope you have a great day.